let me just say welcome back. We're here for part two of our conversation about the intentional use of lived experience while maintaining boundaries. Just a couple of reminders in regard to how we agree to interact with each other. One, we are a learning community. And as a learning community, I'm going to invite everybody to be intentional about the language, the words you use as we engage in this conversation. And knowing this learning community, I know it will be a conversation. But what I'm going to ask is that we use language that is welcoming, respectful, and inclusive of everyone that's in our learning community. Because we're a learning community, this is meant to actually be relevant and supportive of you and your work. So what we talk about, what I bring to the table, what you bring to the table may not necessarily reflect, welcome back, Sheila, may not necessarily reflect the official positions of our funder. And that's okay, because our job is to be able to engage in a meaningful learning community conversation. Also, if you're able to be on camera, if your camera's working, if it works for your particular context or your learning environment, please do activate your camera and be on camera for our full hour and a half. If you're not able to be on camera, and I certainly respect that, a couple of people have already sent me direct and personal messages letting me know that they're not going to be on camera. That's perfectly okay. I'm just glad you're here. Please don't let not being on camera stop you from participating. Your voice is welcome and valuable. Feel free to unmute and or to participate in the chat. If you need to step away, if you need to turn your camera off, just let me know that. Just send me a direct message, be right back, whatever, and then just rejoin us when you come. I'm noting it looks like everybody at this point is muted. Thank you. Do not hesitate. And Melissa knows exactly what I'm going to say here. Do not hesitate to interrupt me if you have something that you want to say. I love being interrupted. What I would ask, though, is if Madison has the floor and she's sharing that beautiful aurora borealis with us behind her, if she has the floor, please don't interrupt her or anybody else in the learning community. Give our colleagues the respect of having the space to complete their statements, sharing their information. And then if you want to add something, react to something, don't hesitate to unmute and follow that person. Also, I think the final guideline, in addition to that you're offering each other that respect of listening, is making I statements. I feel this way. I know this. This is my information. This is how I was trained. This is what I believe. And I'll just ask, can everybody recommit to those particular guidelines as our way of it? Thank you, Terrence. Terrence leads us right off of that double thumb. Thank you, Dan. Thank you. Thanks, Sheila. So again, if you're not going to give me a visual sign or give me an electronic sign, follow Pete's excellent example or Melissa or Will's example in the chat. So those are how we've agreed to interact with each other during our time together. And again, let me thank you for part one for following those guidelines. And I'm confident that they will support our dialogue in this part two. So I am now going to, now that you've all agreed, I'm going to turn it over to Terrence, who's going to remind us of what I invited you to consider and that we will spend a little bit of time talking about at the beginning of our conversation today. Before I turn it over to Thomas, I do want to say this because I reflected quite a bit on part one of our conversation. And I must tell you, one of the things that I really took away from that conversation, and this is just my I statement, I took away that this learning community understands the importance, the value, and the need to protect the benefits of sharing lived experience. And I was very impressed with your commitment to that value to this unique resource, because it is a unique resource. And whether we work in partnership with folks who have lived experience, or we ourselves have lived experience that we bring to the work, do not forget that the presence of that lived experience is doing something very unique and very important to the success of engaging. And I'm thinking of Antonio when I say this, Antonio Ramirez, and holding space for someone where they can eventually possibly begin to trust us. And without lived experience, that can be a harder goal to achieve. So with that, I'm going to turn it over to Terrence. And Terrence, the floor is yours. And thanks for volunteering, by the way.
No problem. And I just summed it up because
Go ahead.
this is what I heard. How do you decide if you're going to share your lived experience? And if you do share your lived experience, how much do you share? That's what I heard.
That's fantastic. Terrence, thank you so much. Is there anything that anybody else wants to add to what Terrence put on the table as to what I invited you to consider? Yeah, go ahead, Dan, please. Floor is yours.
Just makes me think of the buzzword that you were so enamored by, discernment.
Well, and yeah, Dan, we need to give credit where credit is due, because that is actually something that Judith said.
That's right. I forget who said it.
It was
So
Judith.
yes,
It was
you
Judith
got it.
Robinson Denby, and you are absolutely correct that I was enamored by that word, because the discernment and the self-awareness that is required for discernment is really, really. Brian, do you want to add anything to that? I saw you nodding there in terms of that self-awareness. Would you like to add anything? You don't have to if you don't want to, but if you'd like to, feel free to unmute. Go ahead, Brian, please.
I was just agreeing. Yeah. Self-awareness, being able to know first, I believe that the self-awareness allows you to have situational awareness. So that two very key components to being able to do that.
Yeah, thank you, Brian. And that situational awareness that comes out of the self-awareness is going to help you in your discernment. Thank you, Judith. Your discernment of what you're going to disclose or not disclose, or if you're going to disclose. And there's another word, Dan, that I have to acknowledge that I was enamored with as well, which was verisimilitude, that you also put on the table. And again, connecting that to genuineness and authenticity. So thank you for that too, Dan. Chelsea, the floor is yours.
All right, I just wanted to mention that, to me, a discernment is an ongoing process. Like, say you share something deep with a peer,
Yeah.
and they have a negative reaction. Obviously, you're not going to keep telling them that same thing like over and over, or different. It's discernment is also seeing like how different people react, because you might share something with somebody, with one person, and
Yes.
the same thing with another peer or client, and they will react some very differently. So having that, it's not just self-awareness, it's also other awareness, making sure that you're observing how the peer or the client is reacting.
Thank you, Chelsea. And I feel like we have kind of a three-part model being suggested here, which starts with this idea of self-awareness. And then I go to Brian's situational awareness as part of the discernment. And then the the discernment of how is what I'm offering landing on this person in this moment. And that's the attending part of it, because we have to determine what's the impact of what we're saying as we're saying it, because we realize we might need to stop. Miguel, please. And Chelsea, you're also acknowledging too that not one size fits all. Parts of our lived experience may be absolutely perfect for one person and may not be relevant or appropriate for another person. Go ahead, Miguel.
Hi, good morning, everyone.
Morning.
Answering to a question that one of my colleagues made here of how to know and when and how much, Something that I learned through my practice is that clients always, well, it seems like they enjoy when the clinician asks, like, hey, can I make an observation? And after it, explain why you think as a professional that the observation is going to be useful for him instead of just throwing it directly to their face. They may be like, hey, why are you saying this? Oh, well, first, I ask if you're open to listen to this observation. And the second one, I'm going to explain you why I think it's going to be good for you. And an advice that I heard from a professional clinician who I follow, and he's awesome. He told us says, always in your practice have rabbit ears. Like try to see how the client reacts to what you're saying, because maybe he doesn't say anything, but his body can transmit a lot of communication that his words won't. Yeah. So for example, he goes like, well, you're seeing that maybe what you tried to share with him wasn't useful for him. But if he's like looking to your eyes, being like, okay, that is letting you know with him, through his body that he is accepting the message in the right way. And it's when you have questions to his reactions, then you go and ask him, hey, I see that you reacted this way. Is there something that maybe you don't like about what I shared? And in that way, you keep building rapport and getting to know more your client. So those are the advices that I wanted to give, and thanks.
Yeah, thank you, Miguel. And you're acknowledging, and I don't want this to get lost in the insight that you kind of shared near the conclusion, which is you started with, and I love that you use the P word, the practice of asking permission. Is it okay if I share this with you? And then if the person says yes, the rationale for why you're sharing this with them, not just because you feel like sharing in that moment, because it seems relevant to what they're saying. And then you followed that with being very attentive, not only to what maybe they're saying, but what they're communicating with their body language, because that really can speak volumes. And being curious as well, Miguel, because if you notice somebody else's reaction, I noticed you had this particular reaction. I'm wondering if you could tell me a little more about that, because it's a way to get to know the person. Thank you so much, Miguel. Melissa, the floor is yours. And then I saw a couple of people are putting some things in the chat too. So we'll check that, but we're going to give the floor to Melissa C. at this particular morning. And good morning, Melissa.
Good morning. How are you?
I'm well, thank you. And you?
Not too bad. Not too bad.
Good. Glad to hear that.
So I just have a question for everybody. I haven't experienced this yet, but I know one day I will, working in this field. Has anybody ever had any body that was kind of hard to read? Somebody that, they tried to use discernment and all these different things, but just found it really, really difficult to kind of read the person. Because I know that for me, I know that I'm going to come across this. And if anybody has any experience with it, that would be really helpful.
Yeah, go ahead, Miguel. Thanks, Melissa. Excellent question.
Hi, Melissa. Answering to your question, yes. Right now I work with, can you hear me there?
We can hear you a little better now. Go ahead. Go ahead.
So yes, right now I'm working with young adults and adolescents who go through psychotic episodes and schizophrenia. So this mental illness sometimes is hard to understand your client, because part of this mental illness is that some clients may feel like they're disconnecting from reality. So what makes sense and what's logic and coherent to you, to the client, can be like, and react in ways and answer in ways that you're like, this doesn't make any sense. So my best advice is in these type of situations, if you cannot read the body, go through very specific questions that are not too much complex and that can help the client to communicate in a not so deep way, but clear way, so you can make progress with him. I mean, with people with schizophrenia, you cannot ask super complex questions because they may be like, what are you trying to say? But if you go through questions that the client can answer in just a few couple of words and give you the information that you need to help the client, that can be useful. But yeah, like when I cannot understand or read the body, I go to direct questions. And in that way, I don't do interpretations by myself that can be wrong. So the client will always have the truth. So you need to, well, not always, but you need to find his truth, like the information that he's trying to share. And yeah, that's it.
Thank you so much, Miguel. We're going to go to Sheila and then we'll go to Antonio. Go ahead, Sheila. The floor is yours.
Hi. Okay. I agree with Miguel. I think sometimes as clinicians, we may try too hard, like work too hard to try to read the person or really understand. We don't, it's not, sometimes we put a lot of pressure on ourselves because we want to understand our clients. We want to know what they're going through. And I think the open-ended questions is sometimes that's the best to do. Ask questions where ask a question where they have to give you a direct answer. And if they don't directly answer you, sometimes silence works. Sometimes just being able to pick it up, or sometimes just talking about something that may not pick up another topic that may attach to it. But we shouldn't work that hard to really know and really understand where the clients are at that moment, because you have time with them. I mean, I know sometimes if you're intake, you're doing an assessment on someone, but even in the midst of doing assessments and things like that, it does leaves room for some ambiguity and
Ambiguity.
Yes. So sometimes even with that, so just like trust the process, trust yourself. And, sometimes you're the one that may need to take a step back or take a breath to really kind of not, put your own pressures or, only got 30 minutes with the person and I need to have, sometimes you got to take the process, like go roll with the punches, I guess. I don't want to say roll with the punches, but you know what I mean? Sometimes you just have to go with it, because every interaction is going to be different, even if it's the same person. They may be similar, but they're going to be different. So it's just kind of taking it easy on yourself.
Yeah. Thank you, Sheila. And we're going to go to Antonio and Chelsea. But before we do, I just want to underline something, Sheila, that I very much took away. Yeah, and Casey agrees with you. Casey Ann agrees with you. Exactly. Too much probing cannot be beneficial either. But you didn't say it this way, Sheila, but this is what I took away from what you said, that really deeply understanding somebody actually takes some time. You may not understand right away, and that's not necessarily a bad thing. Yeah, thank you. Thanks so much. Antonio, please, the floor is yours.
Okay, so when the young lady asked that question, I
Yeah.
was a little confused, because I don't get to know any of my clients again. They will have misleading information. Always don't give me what they want from the beginning. I had her for a while. She would come in. She wouldn't say anything. She wouldn't say anything for one whole hour.
Wow.
Okay. And then within that hour, my supervisor was like, we're going to transfer her to a female counselor. Right. And I said, okay, cool. So I gave her that warm handoff to get her to get introduced to the other counselor. She's going to be on her caseload. Right. She told me immediately, I don't want her. I said, what do you mean? She said, I don't want her. I want you. But and I'm saying in my head, well, you didn't say anything to me. She was like, yeah, but I wanted to talk. It just takes time. I can't think that this is going to happen overnight, And it blew me away when she said that she wants me as a counselor, because she never said anything. But the thing that caught me was I never said anything to her neither. In other words, what I'm saying is it was just moments of quietness. And that was fine. If you don't want to have anything to say, that's fine. Yep. She would do her work and come to group, but she would not have anything to say. But then I had to realize, just because people aren't saying anything doesn't mean they're not listening. So when she told me she didn't want a female counselor, she wanted me, it made me identify with, maybe I am doing something right? It's just me in my head thinking that it's not working when it is working. It's just like you said earlier, the process is slow. You know, excuse my language, but shit tastes better in the oven than it do in the microwave. So it's not going to happen overnight. It's a very slow cook, especially when you have people coming in and they're adapting to this new way of change.
Yeah. Yeah. Thank you, Antonio. And, you know, this idea that you said, you know, you didn't say anything to her. And the thing that really strikes me is what you said to her, but non-verbally. I'm thinking of Miguel as I say that. What you said to her non-verbally is that I'm holding space for you and it's okay for you to be where you are. And that can be very powerful also when sharing lived experience, because people may reflect on what you're sharing with them. I'm going to hand it to Chelsea and then to Casey Ann. Go ahead, Chelsea. The floor is yours.
Hi, I've been debating about this because I will share a quick personal experience, and
Okay.
there is a reason I'm sharing it. So I was in a state hospital for 2 years with schizophrenia and bipolar. And the reason I'm sharing this is because I was hearing voices from the second I woke up to the second I went to sleep nonstop. And most of the night, I only slept for an hour and I was just talking. There is no way that any of the people who worked at the hospital could understand anything. I'm pretty sure I was hard to read. I'm pretty sure because there were so many thoughts going through my head.
Mm.
But I had this one psychologist who I met with weekly for the first year, and she would ask questions, and that was, that was my way. When I answered those questions, that was her way of somehow trying to understand what was going on in my head. So that the person who said ask questions, that is that's excellent because it gives you insight into, what people are thinking. I can tell from experience it was probably very hard for the staff to understand what was going on in my head.
Yeah. Yeah. Thank you, Chelsea. And again, thank you for your generosity. And Miguel is the person who offered that to us. And I want to underline there, and I think Miguel was onto something there, that simplifying a question as a way of making the connection with the person so they don't feel overwhelmed. And so it gives the opportunity for that person to communicate what may be going on for them in a way that's okay for them. Thank you so much. And Miguel, excellent. Thanks for putting that on the table as well. Casey Ann, we're going to go to you, and then Miguel wants to add something. Go ahead, Casey Ann, please.
Hi. I just wanted to add because I experienced this a lot while working with some teams and one in particular.
Okay.
She would be silent and I was honestly uncomfortable. So I would stay silent too. And similar to what Antonio said, in this weird way, it worked because I would ask her questions, but nothing to do with what I wanted to know about. Just, life questions, classes, just made small talk, so to speak, right? And then allowed the silence. And then little by little, I recognized that, she did have a history of abuse at home, right? She does live in a large, loud family. She doesn't often have a voice of her own, so she doesn't know how to use it, right? So in this room, she was creating a voice. So we have to understand some people are dealing with traumas, but they don't have a voice. They don't know what to say, right? So actually creating a space where you help create that voice, whatever that looks like, right? And then little by little, it was like, okay, she had therapy before. So there's this history as well of not feeling like it's worked, right? Because they didn't ask her the right questions. And some of it was related to child protective services. So it was more focused on punishment than remedy. And I could see that. And I could see where, she felt like they were more focused on what her parents were doing than rather like how it was impacting her. And, again, it really took asking questions, not even going in with questions in advance, but really asking one question and let it just naturally flow. Sometimes we just did homework. Sometimes we just did homework because that's what she needed. She couldn't think about talking about anything else because she had homework to do and she was freaking out about that, right? So addressing her actual needs rather than my need for information to solve some problem that I think she has, right?
Yeah. Thank you so much, Casey Ann. Miguel, the floor is yours, and then we're going to go to Antonio.
Yeah, I just wanted to share two more points that I think are important for those who sometimes have sessions where there's a lot of silence and don't know what to do. So what I learned when I was studying psychology is that first you gotta hold the silence, and that's really tough. Like going through 5 minutes just looking in the eyes, there's a lot of tension, and you may feel the pressure to have to do something, and sometimes you just don't. Just hold to it. Sometimes the silence will push the client to talk at one moment, and it can be anything like, "Why are we doing this?" Well, and then you explain him. So just hold to it. I know it's tight. Sometimes it's hard to look in the eyes, but let's do it. The other thing I want to share is that sometimes answers like just yes or no are better progress than having nothing. And don't put too much pressure on you. Like some clients have gone through so much trauma that it's hard for them to open up and give the details. And some sessions don't even have to be an hour long. Sometimes some clients here in South County, sessions can be 15 minutes, 20 minutes, and for them that's enough. Like, okay, today I make a huge effort. I give you some answers, yes or no, and that's enough for me.
Yeah.
I mean, I'm not saying that you have to end all your sessions in the first 5 or 10 minutes. Try to dig in. But if you're with your client and you seem like, okay, it seems like he's tired today, ask him, check him out, and yes and no answers are better than no progress. And don't get frustrated by it. Healing and opening up about what you're being experienced takes time. And by time, I'm not saying 1 month, can take 6 months. I know that I learned because I'm not from the United States. I come from another country. I was born here, but I was not raised here. But I learned the system here in the United States pushes the professionals to, you have to do it fast. You have 8 sessions. In 8 sessions, you have to get everything. Some clients are going to take months. That's something that maybe insurance doesn't comprehend. But there are clients that are not robots. Like they need time to breathe and process and open something that they have been covering for what, 20 years? There's people that they don't talk about trauma until 20 years later. So let's just be patient. Let's do not fall into the medical system, because if we do that, we are and that's it.
Thank you so much. We're going to go to Antonio, and then we're going to go to Melissa, and then I'm going to ask Terrence to restate what I asked you to think about, and then we'll go from there. Antonio, the floor is yours.
So I love what everybody said, but also my interpretation is, you know, the therapeutic process, right? The ability to build rapport. That's not gonna, I only get one opportunity on that. I only get one shot at it. So I don't need to rush that process. I need to take my time and understand that this person that's in front of me does not know me. This person in front of me is still dealing with, you know, internal issues, you know, that are unresolved. So I don't need to come in. They're still thawing out. I don't know if that makes sense.
Yeah.
But to me, it does. And I've learned this to trial and error, Paul, and going to some of your trainings and actually sitting and listening and you know, getting on the field, not standing on the sideline, you know, getting in the trenches with my clients and having groups where I'm facilitating groups of 25 to 35 people, young people, old people. You know, one of the things I learned about people is they want to feel welcome. And children only go where they feel safe, right? So that safe space that I talk about all the time, that's how I build that. And I only get one shot to build it, right? Because I've also been very destructive in building those spaces where they get up and they walk out and they don't come back, or they tell my supervisor, I want someone else, right? And I remember a wise man that I take great insight from always told me, you never look at the client. If it didn't work, you got to look at what did you do, right? With you, you know, and how can you assess that situation? But you never personalize it. You just want to see how you can improve. So what I've learned in my losses is the loss is not a loss. The loss is a lesson. The question is, am I learning from the lesson? You know, so I'm gonna have people that come in and don't want to talk. I'm gonna have people that I can't read. You know, that's fine. I've had people tell me, you know what, Paul, I know I'm here, but I'm not gonna stop drinking. So, and he tell me that from the beginning, day one. And I say, that's fine. And then a month later, two months later, they say, you know what, Paul, I'm ready for mat services now. You know, so what I'm saying is this takes, and when I said the microwave and the oven analogy, it's like the process is real slow, man. And sometimes with all these trainings and these things that we go to school and we get these certifications, we think that they're going to get it like we got it. No, it took time, man. And it takes time for you to build any kind of relationship with someone, not just in this process of this industry that we work in, but just in getting to know people. It takes time for them to open up and tell you what's really going on with them.
Thank you, Antonio. We're going to go to Melissa, and then I am going to go Melissa C, and then I think Melissa G wants to add something as well. And Bernard also wants to add something as well. So we're going to go to Melissa, Bernard, and then Melissa G. Go ahead, Melissa C.
Well, first of all, I wanted to say thank you, Miguel, for bringing out the trauma piece, because that is really, really important. Because I know, and I like do speak for me, I know that when I started out in recovery, the last thing I wanted to do was unload anything to anybody about any situation that I was facing or going through. I thought I was unique. I thought I was the only one, I thought I was individualized in this whole thing, and that took some time from, them walls and them barriers to get broken down before I would ever speak about anything, and, everybody does have their own process, and I really like what Antonio said too about, how, everybody is individualized, and I'm paraphrasing Antonio. I'm not really good on word, phrases or anything. So please bear with me. And if I got it wrong, please let me know. But how, everybody is individualized and there is a process with this thing, it takes that time to build that trust, especially when you were brought up in a world where nobody could be trusted. It takes that time, I mean, people have been wronged by the system. People have been wronged by, individuals that have said, here I am here to help you. And then they betray that trust, so there's a lot of factors that come into play with that. And I really thank both you guys for opening up and sharing your lived experience with me, because that brings me back to perspective. If I'm not the problem, then there is no solution. All I could do is work on me and see what didn't work and use those to try to better myself, if that makes any sense.
It does, Melissa. Thank you.
Mm-hmm.
Thank you so
Thank
much.
you guys for sharing.
Bernard, the floor is yours.
Morning, everybody. This is great, and I just wanted to add and contribute. I work in a 16-bed residential crisis stabilization facility, and so I can't always meet with all 16 clients, and we rotate clients, of course, as beds become available. And one of the things I've noticed as we're talking about rapport building, one of the most important things is when I come to work, I grab my coffee and then I sweep through the house and at least nod, give eye contact, or non-verbally acknowledge everyone in the house. Because to piggyback on what we're already talking about, in terms of gaining trust with our clients, it's not so much what we say to them, it's how do we interact with them before we have to say anything? How do we interact with other staff members? Am I polite and pleasant with my fellow staff members, or am I rolling my eyes and, showing my disdain for some of the people that I work with, or whatever that may be? So I think in my experience, one of the most important things to remember in terms of building rapport with an individual is they're watching us from the moment they enter the office. So why would they trust me in a one-on-one when they saw me earlier and I didn't acknowledge them non-verbally? They saw me earlier and I was shady towards my coworker. They saw me earlier and, I was late and seemed discombobulated and seemed like I didn't know what I was doing in the setting. So I just wanted to add all of those things factor into why and how we garner trust with our individuals.
Thank you. Thank you so much, Bernard. And again, expanding out that we are communicating with the folks that we may provide care to or share part of our lived experience with, even before we're ever sitting in front of them or sitting with them. Thank you. It's really important to consider. Melissa G, the floor is yours.
And this may be a restatement of what a lot of people have already said, but I just feel like the best thing that we can, because I want to go all the way back to when this whole conversation probably even started, when the young woman was worried about the client being hardened or unable to be or unreachable or whatnot. In this work, you will drop seeds, right? You will maybe not ever see the full fruit of the work that you invest. People come, they go. There's a lot of that. So you just have to be confident in the fact that you are showing up authentically, sharing space in the very best possible way that you can, and then just trust the rest of the process and have faith in that, and know that you gave what you gave in the moment to that individual, and trust that it will make the difference that it's meant to make in the long run, right? I think we just kind of have to have a little bit of confidence in that, and just I think, as the way that Antonio said, faith in the process. Like, you have to just, and then we follow and do all the things to the letter, the best letter that we possibly can, and then I think we trust the greatness of the universe to like put all that to good work for people. But that's just what I.
Yeah, thank you, Melissa. And if it's okay with you, I'd like to add something to what you said, because I want to connect it with what Bernard said. And tell me if you're okay with this, Melissa, because if you're not, by all means, feel free to reject it. But what I'd like to add, and I'm connecting this to what Bernard said, is that we are potentially planting those seeds. And Antonio often says this, that every client is actually my client, whether they're on my caseload or not. Because if they know, generally speaking, they may know, a lot of the folks who work here are people with lived experience. And as Bernard said, they are watching everything that we do, whether they're in a meeting with us or not. So potentially we are planting seeds, even if that person's never on our caseload. Are you okay with that, Melissa? But if you're not, I understand.
No, I concur. I think that that's very true. Whether or not we have access or experience with individuals, it does not mean they are truly not watching our walk and our talk.
Yeah.
So I think that's why it's important you show up authentically and you do your very best, be the best version of yourself you can be today at this moment. That's it. And then the chips will fall where they may in a good way, we hope, right?
Yes, they will align as they're meant to. Yeah. Thank you so much. So Terrence, I'm going to hand it over to you to just reiterate what I asked people to focus on, and then we really do have to take a moment and just look at some of what came in the chat, because I want to acknowledge the fact that people are engaging in a rich conversation in the chat as well. Terrence, go ahead, the floor is yours.
Okay. When you feel you should share your lived experience, how do you decide how much you're going to share and what's appropriate?
Thank you so much. So I'm centering that again on the table, just to see if anybody wants to add anything about how you determine if this is a moment where my lived experience may be of value, and then how you determine how much of your lived experience you share. And Sheila, I'm going to hand it over to you, but I'm going to just take a look at some of the chat for a minute too, okay? So let me just take care of that briefly, and then we'll turn it right over to you. So I'm picking up with Bernard wrote in the chat, important to manage our own anxieties as persons who authentically want to help the client. And Dan adds, I'm comfortable in the quiet with you. And again, we can communicate that non-verbally as well as verbally, I would think, Dan. But you let me know if you're okay with that it can be a non-verbal communication as well.
Yeah, it was just a nod to Antonio's story of his unconscious nonverbal conveyance to that one client. Yeah.
Fantastic. Thank you. Yeah, because that was the message that he was communicating by his behavior. Chantal adds, it's not what you say, it's how you say it. And sometimes it's about listening, or it's holding space for them to reflect as well as the clinician. Will writes, we need to listen and meet the patient where they are at. Absolutely. Jacqueline writes, assessment of the client or special population is important. Teens may be less inclined to connect with adult lived experience. Agree with Casey, ask concrete questions while observing nonverbal behaviors. Casey Ann writes, it can re-traumatize the client if they aren't ready to open up to a stranger. Absolutely. Especially with so much stigma surrounding many of the issues people struggle with. And a one-size-fits-all approach simply doesn't work. Will agrees with you there. Pamela adds, yes, and it must also be culturally appropriate. While simplifying questions, clinicians should be mindful of the client's cultural background, language, values, and communication styles. Thank you, Pamela. Bernard also adds, also clinical and or regular peer supervision is a great way to process our anxieties or reticence about interventions with clients. Yes, because it's a learning process. It's not a perfection process. Absolutely. Pamela adds, sharing your own learned experience can help build trust and show empathy, but it should be brief and relevant. Make sure to focus on experiences that normalize their feelings or challenges without shifting attention to yourself. Chantal adds, in my current position, I usually am meeting with the client the first time due to working in crisis intervention. So I have to be able to build rapport quickly and read the room. Since we are only allotted 1 hour, by remaining authentic and genuine, I usually am able to make the client feel safe. Sometimes they open up, but sometimes they don't, and that's okay. Excellent. Sheila, the floor is yours, and then we're going to go to Will. Go right ahead.
All right, I had to unmute. Hi. I am, when I'm at work, okay, let me just backtrack. Right now, I don't currently work with clients for work because I'm kind of like on the other side of it. But even in talking with my friends, working within my church, a lot of stuff that we've been talking about, like discernment and boundaries and stuff, are things that also, as working within the church, also that we do that. And so when I'm talking to someone, because people know my background, people are always talking to me about something, and I'm very mindful when I'm sharing anything personal about me, that I'm sure whatever I'm going to disclose to them is beneficial for them and not for me. Because sometimes we can get really caught up in, oh, I've done that, and this is what, based on whatever whatever brought me through has done for me, and you start touting your own my own doing or whatever. So I have to be very mindful that what I'm going to share for them is that when they walk away from, they realize it was for them and it wasn't for me, because it can't be about me. It has to be about them. Then the disclosure is not beneficial to them, and then that kind of changes. Sometimes changes the relationship in a way where you don't want it to be, because now they know something personal about you and it didn't benefit them. Maybe some animosity behind that. So I'm extremely mindful of that. And I just real quickly, I can remember when I first got into the field, and of course, like once you learn psychology and human behaviors and stuff like that, I wanted to go around and analyze everybody. And I wanted to give my input to everyone. And my godmother said to me, everybody's not interested in you analyzing them. And it was hurtful, but I was showing you, I put my shingles out, and I'm now this whatever counselor or whatever, that it wasn't about me. It wasn't about them, it was about me. So that has always stuck in my mind, that whenever I am doing any kind of work and I'm sharing anything, and I have read the room and have the discernment, like I said, discernment is being able to read the room and the audience, that it's for them. Because I can get what I need for me, I get from my own people or from my own therapy. That's not the purpose of me being there. So I'm very mindful of that, and who I share with and what I share with them. And then also, once I share it, I kind of like, well, you get what I'm saying. Like, make sure there's a follow up to why I've said that. Or even if it's a nonverbal cue that I see that they got it and it penetrated their own their situation or their hearts or their minds. And I don't feel like I also check in with myself, because I also don't feel like, why didn't I solve that for them? And now I'm this great, like I'm not ego tripping. So it's really kind of like checking in, really not just dropping it, but really kind of seeing if the person really got what you meant, in case you need to clarify it, unless you need to pull back or you need to give a little bit more, or I need to give a little bit more. But just remember to maintain those boundaries, even if the circumstance. And this is very quickly, I had a conversation with somebody who was on vacation. They brought up something, and I brought up one of the experiences I had in regards to feeling out of control. But when I brought up when I told them, when I explained to them, I thought about it and I said, well, this was the situation I was in, and I did this control. I couldn't control the situation, so I was going to control what I was eating. I decided I was going to be vegetarian, vegan at a split second. And it was it was a very painful situation I felt I was in. But when I explained that to them, it wasn't for me to talk about how I overcame. It was for me to kind of give them a different perspective about being out of control. And so once I was able to say that to them and I saw that they got it, and it did not, only thing that I got from it was that I was able to use that experience in order to help somebody else, but it wasn't to boost my ego. Then I knew that I did the right thing. So like that, also that checking in, and then even checking in with someone after having experience, some about my own person, to say, this is what happened. So that's where supervision is really good as well. When you're in these situations where, you may have disclosed something, share it with your supervisor, share it with your colleagues, just so you can kind of keep a check on it for your own well-being. And so you'll have some kind of follow-up. So I know it's a little long-winded, but.
Thank you, Sheila. Will, the floor is yours.
Thank you so much. I wanted to share with Sheila, my wife tells me that leave your job at work, don't bring it home.
Your wife doesn't want to be analyzed.
Absolutely. A lot of people have said a lot of great things, man, and I tell you one thing about this job. Patience is so important, and meeting people where they're at. I know we have our own agendas. Like, I work at a detox and 28-day rehab. I've been here forever. And sometimes you just want to get like, okay, man, can we just like jump these hoops and get here? No. We have to be so patient, and compassionate at the same time, and not drop no lugs on them to try to get them to kind of escalate everything and expedite it a little quicker, right? What I do know is that a lot of our patients come with the shame and guilt, of their addiction, whether their education was destroyed, they've been through divorces and lost great jobs, right? And then a lot of them come from those families that are extremely dysfunctional on a lot of different levels, and one of the things that I know is that quiet moment tells it all. That quiet moment tells it all. Because I've had a lot of patients tell me, if I tell you what I've done, if I tell you about my misdeeds, will you still respect me? And will you still work with me? And I'm gonna tell you something. That there stabs me in the heart, because I get it. I do understand that. And that's why that gift of being patient, and I know we get them for a month, 6 months, whatever it is, right? You have a 45-minute session, you have an agenda, but I think even if they need to sit just quietly and say nothing. I'll give you an example. This morning, yesterday I was assigned to a guy from Peru. He has 4 siblings, 3 brothers and 1 sister. Every brother is a full-blown alcoholic, and the sister's fine. She can have a glass of wine and walk away. She's a sociable drinker, And I spoke with the mother this morning, and if you heard the pain in her voice, right, it was just, and I sat him right there. I said, come on, sit right here. Let's talk to moms. She called the doctor. She said, I need to speak to a professional, preferably someone who speaks Spanish, and I definitely understood. But let me say this, right? So lived experience, right? I remember when I used to think my father didn't love us because he won't stop drinking, you know, And I wasn't dropping that on her. Like, I understand I had an alcoholic father and blah, blah. It's not time for that right now. If we could set up a family session, the time may not come that I don't have to share that, right? So sometimes that live experience, you got to put the brakes on it and wait for the timing, because timing is essential. And somebody mentioned it. You can share too much and lose them, and they won't come back. They
Yeah.
won't come back.
Yeah.
Or you can have the appropriate timing
Mhm.
and feed them what they need to be fed so they can feel that they are not alone. And you see, that's a big issue. You are not alone in this. Plus, our patients always want to know, so I need to know, are you an addict? You know, are you one of me? How could you help me? You've read books. You know what? Helping doesn't mean that I'm an addict. Helping means that I want to help you make a difference in your life to maybe improve it or make some good decisions at the end. So I think we need to listen a little bit more and understand what it is. I tell you something, I am fascinated by the 35 years that I'm working in this business, because when I first came around, we beat them up, we told them what to do, we told them when to breathe, when to get up, and now it's all patient centered, meet them where they're at, harm reduction, MAT, and all this stuff. It's just an amazing, amazing journey, So I love all you guys, and I really appreciate what everybody has shared. Thank you so much, guys.
Thank you, Will. And before we go to Antonio, I just want to underline a couple of things that Will said. And one of them, which I think is really critical and very valuable to our conversation, Will. So thank you for talking about your current experience providing care. It's probably pretty likely when we're talking to folks, if we have lived experience and we're talking to folks who have had experiences similar to our experience, it's probably pretty likely we are going to be taken back to very specific moments in our own experience. That's probably a pretty normal dynamic that's going to happen. And there might be a knee-jerk response to want to put that on the table. But as Will described, and I think he described so clearly, is that we have to assess. We have to acknowledge, oh, I was reminded of my father, and that I didn't think my father loved me because he wouldn't stop drinking. So that's part of the conversation you're having with yourself, to acknowledge that you were taken back to that place. And then the discernment, thank you, Judith, comes in when you determine, is it appropriate in this moment, this situation where this person is it appropriate to bring that to the table at this particular point? And Will, you determined in that moment that it was not. It may at some point, but in this moment, no. I was taken back there, but it's not a moment for me to use my lived experience. So there's that discernment. The other thing that I just wanted to touch on before we go to Antonio, Will said, and I bet you're not alone in this, Will, that many people will say, well, how can you help me? Are you an addict too? And it makes me think of Antonio Ramirez when I say that, because I think what the person is really asking, and I could be wrong, but I think they're asking two very specific questions. Question one, is it safe for me to be me here? Question two, is this person going to be able to understand me? And maybe question three, and will you inspire me to add question three? Question three is this person going to judge me? So is it safe? Will I be understood? Is this person going to judge me? And I think we can, and I'm thinking of Miguel and Antonio, I think that we can verbally and non-verbally answer all of those questions by how we interact with that particular person. So Will, thank you so much for inspiring that and for putting that on our learning community kind of radar. Thank you for that. Antonio, please, the floor is yours.
I believe the simplicity of what we do is just being able to guide the individuals through this process. Don't walk in front of them. Don't walk behind them. Just walk side by side with them. And it's okay if it takes time, man. It's okay. You know, all of these things that I talk about and all of these things that I like to bring to the table after I hear people share is based on what I've experienced and what people have told me to take a look at, right? And a lot of times we learn some stuff and then we say, we don't have to do this, we don't have to do that, but you didn't even really try it, right? You didn't even really try it. You got to know how to try these things. And that's what I've learned. I've learned how to try things and incorporated it within my counseling, right? Not just with individuals that come into the treatment center, but people that come into drug court. You know, they're not going to come in with the best attitude. A lot of people come in with a bag full of trash, and that's okay. If you want to dump, dump. I'm here to receive that. That's cool. I ain't got no problem. And I don't personalize it anymore. I remember when I first started, man, as a peer support specialist, and I would get real angry when people don't see what I'm trying to do for them, right? I'm trying to do this for you. I don't get all into that no more, man. It only becomes personal when I make it personal. I'm here to save your life, right? I'm here to save your life. I'm here to give you something different. And that may take time, that therapeutic process, man, you know, that alliance, being that skillful helper, you know, that takes time, man. The simplicity of how I approach people now, I try to approach them with an icebreaker. Welcome, good morning. Would you like a cup of coffee? Would you like a bottle of water? Sometimes I might have Madeleines in my office, you know, those little shortbread, like the little small little, like sort of Laura Doone, Sara Lee little cakes. Here, take one. How you doing? They might not, or those little high chews or whatever. I set it up like that, or I have art in my office where we can have a conversation piece. It doesn't always have to be about, are you ready to change right now? That takes time.
Yeah.
So that's my process, man. I don't know, but then when it comes to the lived experience, I really kind of step away from that because I don't like to share my personal business with everybody. That's not for you. That's for me. You know, because then I'm crossing the lines as my clinical ethics, right? I don't need to share how I got to this point in my life. The process right now is to be about you, you know. So I heard this, you got to stay out the weeds. So I try my best to stay out the weeds.
Thank you, Antonio. And before we go to Judith, I just want to underline that keep in mind, because of the nature of the work that you do, if you are a person who's employed and part of your employment is the intentional boundary use of your lived experience, that actually is a part of the work that you do. And the whole reason for us to be together, the whole reason for us to even have this conversation is so we can acknowledge the value and the importance of that, make sure that you stay safe, and that you have your own unique process in place of determining when, how much, and if you use parts of your story that are appropriate for that moment. Because in Antonio's position, lived experience may not be part of his job description to bring that to the table. I know that there are people in this learning community that it is probably written in black and white in your job description. And again, it's about doing that in a way that benefits the client, keeps the spotlight on them, and that you're making an intentional decision about it. We're going to go to Judith, Chelsea, and then Terrence. Go ahead, Judith, the floor is yours.
Hello. So I wanted to share that I did share yesterday that I am in recovery, and I have shared my story at different times, just depending on the situation. But I have asked clients when they ask me that question, like, are you an addict? And I would first ask them, well, why is that important to you? And then I would continue with, well, if you were going to need open heart surgery, would it be important to you if that doctor had open heart surgery? And would you give us the opportunity to have a few sessions to get to know each other. So that's how I would approach it sometimes.
Yeah.
That's all I wanted to share.
Yeah, thank you. Thanks for putting that on the table. Chelsea, the floor is yours.
Hi, all I wanted to say, and I think this has been reiterated in different ways, is that building a rapport is probably one of the most important parts of self sharing because, and I think Antonio gave some really good examples of how he works to build the rapport. And because if you don't have a good rapport and you share, it's not gonna, it's gonna go nowhere, and they'll probably actually go to somebody else. So, like, definitely don't self-disclose in the first session or even the first few sessions. Make sure that, you know, that there is that report before sharing. That's all I wanted to say.
Thank you so much, Chelsea. And it's a very important connection to make because, again, that self-disclosure could appear like a desperate attempt to create rapport as opposed to coming out of the rapport we've built because I'm discerning what you may need at a particular moment or what may benefit you at a particular moment. Terrence, the floor is yours.
Right. I really liked what Judith had to say about the doctor and the open heart surgery. That was a good example. As being a person in recovery myself, it was, for me, it was hard if the teacher, like we were taking classes or whatnot, and the teacher didn't have lived experience. It's like, then how do you know what we're actually going through? You're reading out of a book. You're going off of what some doctor wrote or whatnot. So that was what always my question. But when you get over that and you finally want to recover, it doesn't matter if they have lived experience or not, if they can help you with the answer.
Yeah.
And then nowadays it doesn't bother me. And in my job description, literally right on our page, right on Advocates for Recovery Colorado's page, you have to have lived experiences or you can't have this job. And you also have to have recovery and take that time off of work whenever it is that you do your recovery stuff. If not, if you don't, they're going to our supervisors sit down with us and have a conversation about this. And if you're not sharing your lived experience right, we don't share the war stories, we share the successes. And if we don't do that right, they'll have that conversation with you. Yeah. So we have to share. It's just knowing when to share, as in, like everyone said. Yeah, I mean, because and also you have to have it in your head. Are you sharing for yourself or are you sharing for their benefit? And that's the biggest thing. We don't share for ourselves. We share if somebody went through a similar thing that we've been through, we can tell them how we got out of it, and what we do, we follow up with. It might not work for you. We recommend you explore all avenues of recovery.
Yeah, thank you, Terrence. And you know, Terrence, you just brought something to the table that I'm not surprised we're discussing in this learning community, but it's a subtlety that I think bears repeating, which is that one of the unique elements of the gift, I'm going to frame it that way, the gift of appropriate and intentional lived experience is that it creates the opportunity for the person seeking care to make a very unique connection that they need at that moment. They need to be understood. They need to know they're not being judged. They need to know that they can identify in some way with you, which they may not need as much or at all once they get to another place in their growth process. And Terrence, your example of that, I think, is a really good one. At a certain point, it didn't matter that the teacher didn't have lived experience. At a certain point. And that is, again, one of the unique things. Keep in mind, folks, when you're working with people and you're working with them in the use of your intentional and appropriate lived experience, you are working at a very unique time in that person's growth, at a very vulnerable, important time in that person's growth. And to Melissa G's point, you may not know the outcome of that, and you still have the opportunity to plant seeds. But you may not know the outcome. So, having said that, folks, as we start to bring this conversation, this learning community, at least this learning community, to a conclusion, I just want to run past you a few, how can I put this, structural kind of concepts that will support everything that we've talked about so far in terms of the process you go through. And again, I'm borrowing Judith's very insightful word, and I have to give credit where credit is due, of the process of discernment, so that you can be intentional, focused on them, and the right amount at the right time for the situation. Okay, so you're going to get a copy of these slides, but I just want to take a moment to walk you through a few of these structural frameworks, and then I'm hopeful we'll have a little bit more time at the end for anybody to make any comments about your own experience in our learning community together. For now, it'll be about 3 hours. So hopefully, time permitting, we'll be able to have an opportunity for that kind of reflection as well. I'm going to share my slide. Okay, so this has been stated from day one. And again, just important reminder structurally that lived experience is very personal. It's unique. It's real, all caps, for you. It's a part of your life, a part, not your whole life, but it's a part of your life. And you may have experienced the whole spectrum of emotions in regard to your lived experience, from pain to joy and everything in between. And it's also a journey. Having lived in experience doesn't mean you've reached a destination. It means that you're still on a journey, and your life continues to grow and move forward. So we can think about lived experience in an informal way, and we can also think about it in an employed way. Informally, you may choose to share your lived experience, or may choose not to share your lived experience with your family and friends. You may choose to disclose about your personal recovery process, if indeed that's a path you're on in terms of your lived experience. Most likely, in an informal way, you're not receiving any financial compensation for the disclosure or the sharing of your lived experience, and there are no enforced standards. Informally, it can be all about you. It can be to meet your needs. Again, this is the informal, no enforced standards. And Terrence, I'm thinking of you when you so clearly described the supervisory structure, which again implies that there are standards or goals to be met that are prescribed, that are laid out, and people are being supported to reach those particular standards. So then we have the employed lived experience, which again, Terrence, I think, gave us, and again, thank you for that, Terrence, such an insight into what employed lived experience is. You may work for an agency or a particular program. You may provide particular services. There is financial compensation. There's a job description. You get paid for the work that you do. And there are standards that are to be met and maintained. So we know that the benefit of that in common experience can lead toward trust. We know that there can be a shared or shorthand language and can help the person feel understood. The person can also feel respected, and it could help you to more quickly understand what the person is telling you because you've had that experience. And again, your own firsthand understanding. Again, your experience is not their experience, but there could be a realm of similarity. The other piece, and Terrence, you alluded to this very specifically. You didn't say it this way, but you alluded to it when you talked about the teacher. Well, how can you learned this from a book. How can you do this when you don't know what we're going through. That's an issue of not having credibility. And at a certain point, credibility, the ability to understand, is very important. And it can be a powerful way to intentionally and appropriately engage somebody and potentially lead to trust. And that we are modeling for that person. As I believe it was Bernard who said, you know, even if a client is observing me speak to a coworker or the receptionist, I am modeling, I am advertising how I am. And clients are always, participants, consumers are always watching that. And it's possible, some of the benefits of lived experience. And again, I think I'm thinking of Miguel as I say this, with permission, we may offer informed suggestions and advice because we've gone through our own sort of process. And the largest aspect, and sometimes this is verbal or nonverbal, and again, I'm thinking, Bernard, of your really powerful example, is that you can actually be an example of hope in the lobby because of the way you conduct yourself. And again, another incredibly, and that person may not even be on your caseload, doesn't mean that you still aren't an example of hope potentially. And as Melissa said, that even that observation sometimes will plant a seed. So we know that that in common effect is the foundation for everything that follows, and it creates opportunities and possibilities. So how you are after the in common effect really does matter, because that may be the way in. You still want to be in a partnership with that person versus informing the person that because you've had the experience, because you are where you are, you know best. Also, offering that person acceptance versus judgment. And again, sometimes we hear things that are hard to hear. We still, and I'm thinking of Antonio as I say this, we still want to hold that space where the person feels that they're not going to be judged, especially if they've taken the risk to disclose something to us. And that we can be very clear about offering empathy and compassion as opposed to giving directives, telling people what they have to do. And we can empower people. And again, Terrence, I'm thinking of you as I say this, because you said, if you do make a suggestion, if you do share a part of your story about how you accomplish something, you conclude that with, you know, this may not necessarily be your path, and there are many paths, and, you know, of course, we're here to explore the path that's going to be best for you, as opposed to telling a person there's only one right way to do something. And let me say, it takes a lot of skill. It takes a lot of self-reflection to not want people to do what you did because it worked for you. So just keep that in mind. Now, the disclosure of your story, what you did, parts of your story. Somebody in a prior learning community once said, you know, I never share parts of my lived experience that I haven't healed from and done the work that I needed to do in order to share them. So again, we're always making decisions in the moment about what is the best thing, the appropriate thing, or maybe it's better to say nothing at this particular point. So just keeping that in mind. And we know that the reason we may share our story or what we did, and I'm going to say it very simply, and this is a massive summary, and if you agree with this summary, type an A in the chat. If you're unsure of the summary, type a U. And if you disagree, because in this learning community, we don't have to all agree. And if you disagree, type a D in the chat. And let me make the summary before you weigh in. But why you tell your story or share what you did or how you got through is basically because it's appropriate in the moment and it will benefit them, not you. If you agree with that about why you tell, type an A in the chat. If you are unsure, type a U. If you disagree, type a D. Okay, so far it's seeming that people pretty much agree with that summary. Again, that it's appropriate to the moment, it benefits them, and it's not for you. Okay. You're not getting your need met. So a couple of things to keep in mind about avoiding a dynamic called auto-disclosure. Auto-disclosure is a term I made up, and it simply means that, you know, because I do this work, I tell my story. So whenever an opportunity comes up, I tell my story. And of course, what we choose to tell, the depth at what we choose to tell, the amount of what we choose to tell is unique and tailored to every single moment where disclosure may be appropriate. Because in some moments, as Will gave us such a great example of, it was not in that moment appropriate for him to share his lived experience and what he was brought back to about his relationship with his father. He chose not to disclose that through his discernment of the moment. Again, before you disclose, you can ask yourself these questions or answer these questions. Why now? Why this part of it? And what do I intend? What am I hoping to achieve by telling? And am I triggered? And who is this for? Is it because I'm triggered and it's for me? I want to get it out? Or is it because, you know what, even if I am triggered, this is an appropriate bit or piece to share in this particular moment because it will benefit them and it's not about me. Yeah, and Melissa, really great point. Melissa adds, your lived experience may not be for everyone. That's completely true. And that doesn't mean you still can't have credibility. You still can't do the work. It just means that you're not going to be offering that information about yourself. Yeah, go ahead, Antonio, please. The floor is yours.
So what I'm also hearing is your story is not their story.
Absolutely, and beautifully said. Your story is not their story. Their story is uniquely theirs, just like your story is uniquely yours. Absolutely. And as Miguel mentioned, this idea of asking permission, would it be okay? Would it be okay if I told you about, or if I shared this particular suggestion? And Melissa also adds, checking your motives is key when choosing to share. And Casey Ann writes, spot on, exclamation point. Couldn't agree with you more. So, a couple of disclosure related questions. Why do we want to avoid auto disclosure? Because as we've been making the argument, as we've been going forward, disclosure, your story may not be appropriate for every situation or every moment. And we want to be very clear about not being on automatic pilot in regard to this. We know boundaries, emotional, physical, practical, ethical guidelines and limits. We know that they are there to keep you, let me emphasize that, to keep you and those you interact with safe, healthy, and independent, as opposed to dependent. And a couple of considerations around boundaries is we all have personal boundaries and our own personal histories around our boundaries. And some of us may have had to work very hard to learn how to have boundaries. Agencies and programs have specific boundaries built into job descriptions or the tasks that you do, the person that you're working with, the client or the consumer or the community member, will have their own boundaries, or maybe not, because they're used to having their boundaries violated. And I chose that word very intentionally. And they may think they're only interacting with you if you're violating their boundaries. And of course, we want to avoid being drawn into that. And boundaries, of course, require perpetual and ongoing reflection, self check-in, and as our colleague said, checking in with colleagues and supervisors. Adolfo adds in the chat, I share my story if it is similar to the client. The purpose is to let the client know how the provider got that situation over. Understood, Adolfo, that that's the intention behind it, to model that it can be gotten over and that there was a specific way you got over it. So keeping in mind that the more we have in common with somebody, the more important it is to keep and maintain those boundaries. Stress can actually erode boundaries. Our own personal stress can erode boundaries. We want to, of course, resist keeping any kind of secrets that are related to your interactions or your feelings with the client or participant. So we've also made the distinction that lived experience really does offer, at a very unique time in somebody reaching care, something that they may critically need in order to engage in care and begin to build trust. And that's why lived experience has been woven into and continues to make profound contributions to wellness and health, because it is a very specific need at a very critical time that somebody without lived experience can't provide. And that's doesn't mean they can't provide good care. It just means they can't provide that kind of care. So we know it's a double-edged sword. We talked about that. If you like videos, I did include a link on this slide that you can check out at your discretion when you get the slides. And it's basically just a little video about a very famous sword called Excalibur. Bernard, the floor is yours. Go right ahead.
I know we're about to close out, so I'll be brief.
Please, go ahead. Yeah.
You mentioned that they're unable to provide. I do want to say, as a former clinician, now peer recovery specialist,
yeah,
sometimes they may have the lived experience, but they cannot share that with you because it's not appropriate as a clinician.
Yes,
so
it's not appropriate due to the nature of their work. Absolutely.
Exactly.
Yeah, and Bernard, thank you for underlining that, because Antonio made the same statement. Antonio is somebody with lived experience, and due to the unique and specific nature of his work, bringing his lived experience in a very overt and intentional way is not appropriate. Very exactly what you're saying as well, Bernard. Thank you. Thanks for adding that. So keep in mind, folks, that successful employment of lived experience means that you know yourself and that you're open to knowing more about yourself, that you have self-awareness and you work on self-awareness, because we all have blind spots, and that you have personal as well as employment boundaries. You do ongoing self-assessment, checking in, checking things out with people, and that you're aware of the dynamic of countertransference, that it can happen, it comes up, and that you ask for help and support when you need help and support from fellow colleagues, from your supervisor. And also remember, your lived experience is invaluable, it's an asset, and it does require intentional use and management. You may identify and your experience is not the same as somebody else's experience. Antonio, thank you for stating that so clearly a moment ago. And our right, how we solve the situation, could actually do that person harm. So that notion of that, as Terrence said, It worked for me. It may not necessarily work for you. And again, we want to respect their autonomy. So the final thought before I say thank you so much is, remember, they're like you, possibly in their experience, but they're not you. And that blue line is the boundary. I just want to thank you all so much for your generosity and for your presence. It's been an honor to be here with you during this conversation. And I'm very much looking forward to being in future learning communities with all of you. Thank you so much, everybody. Take very good care, and my apologies for going a minute over.